Now, once again, let me follow this up with a caveat. I'm not posting this looking for sympathy. I'm posting this as educational. Maybe it'll help somebody else. Do not ignore gut issues. You're not going to walk this shit off if you got an ulcer. Okay? Back in December, January, I had a burn where now I know I have the ulcer. Again, I ignored it. In Let's get into the when the ulcer ruptured in late April 2020. I woke up with a pretty good pain, which wasn't unusual. I mean, I suffered a lot of pain throughout 2020, but this was kind of a different pain. I had a pain directly across in a straight line, directly across my underside of my ribs, and I always slept on my left side because it was more comfortable. I couldn't sleep in any other way. So when I sat up, and it was about 5 or 10 minutes when things started to move down. It was like a curtain moving down over my stomach, and that's when I realized I had a problem. That's when I realized that I'm gone septic. My ulcer ruptured, and I knew it. By the time I got to the hospital, by the time I got caretaker from Mountie and get a ride to the hospital, I could barely breathe. My breathing capacity was probably at 10% because the pain was gone all the way down through my gut. The sepsis had gone all the way down through my gut. I entered the hospital. That was the first time. I've got an extreme level of pain tolerance. That was the first time that I screamed in 2020. I came into the ER, and that's the first time I ever got wheeled in. Through all of the dehydration, the blood loss, and everything else, I was walked into the hospital. That was the first time in 2020 that I ever got stretchered in, and the last time. When I hit the ER waiting room down at the Grey Nuns, within 15 minutes they had me in CAT scan or CT scans. They had X-rays done, and I'm back in the room. And the doctor walked in, and I can't fault this doctor. Why he didn't see what was going on is beyond me, but they literally drew straws to figure out who was going to have the operation. Because these novel operations that nobody else has done, that's the reality. They all fight for it. It's like a episode of frickin' Grey's Anatomy. So the surgeon came in and he admitted that they drew straws because none of them knew what to do. None of them had ever seen anything like this, and they consulted with doctors around the world. Nobody had ever seen an ulcer like mine in the position that it's in on me. And he fully admitted, I don't know what I'm going to do when we get in there. We don't know if you're going to live or die. So I got two choices right now. Right now, I'm near death. I'm dying. So he gave me a choice. They can either drug me up and let me die, or they can do a Hail Mary operation and try to save the life. So I said, you know what? I know it's a novel surgery. I know it's the feathering cap. If I survive, you got the feathering cap and you got the bragging rights. So I said, here's the thing. I can either die in the back or I can die in the operating table. You know what? If you can give me your A game, you can have the novel surgery. You can get the feathering cap. They opened me up. Here I am. I'm still here. I can't complain about what he did. How we didn't see all the scar tissue while he was inside of me is beyond me, but there was no mention of it. Okay? Now, recovering from that was bad. And the only drug that I can take right now is Dilaudid. I can't take morphine, I can't take Valium, I can't take anything else because for some reason it just does something to my brain that just I can't shut down 12, 14, 15 hours. I just go totally squirrely and I don't want to take a chance on taking any painkillers. Okay? So Dilaudid is my only game. And Dilaudid ranks right up there with heroin. They give heroin addicts Dilaudid by mouth to get them off the heroin. Okay? This is what I'm taking. And I'm taking anywhere from 3 to 4 milligrams every shot. 4 times a day. For about a month or two. It takes about a week for addiction to kick in. Now I understand why people that get cut off of drugs, they go to the streets and they become homeless after a while. I will never, ever judge a drug addict on the street again because I know now what it takes. And I was facing that same decision because now I'm an addict. When the day they released me from the hospital, they gave me a 4 milligram shot of Dilaudid and they sent me home. I had no more backup painkillers. They never gave me any painkillers. They never gave me anything when I left the hospital. So I left the hospital stoned. I walked out stoned. And when it wore off about 5 or 6 hours later, that's when I realized I had a problem. I called the hospital. Well, COVID is on. We got no help. You're on your own. Welcome to AHS. Welcome to Grey Nuns Hospital. I've got a choice to make now. I'm an addict. And I'm starting to get the shakes. I'm starting to get all the symptoms of drug withdrawal. And we're getting off of heroin at this point. Okay? I couldn't imagine being on that shit for years. Being addicted to that shit for years. I was only addicted for a month or two. But I got my cousin to go to the store and get me a bag of cannabis, and I spent 24 hours a day stoned for a week to try to at least cannabis took the edge off the side effects. Because if I didn't have cannabis, let me tell you something, I would have been on the streets myself. I will never ever judge another person on the street for taking drugs because I've been there now. I know what it takes to make that choice. Understand something. Addiction itself is not pretty. Addiction should not be judged. Okay? That's the reality. And considering I lost my train of thought on the last episode of the video, addiction itself should not be judged. There's a reason why people turn to addiction, because there's something bad happened, whatever have you. If it wasn't for cannabis, I would still be an addict today and living on the streets. What did cannabis help do? It took all the edge off all the symptoms. It didn't cure them. But if you're dealing with addiction and you're trying to get off addiction, cannabis. Try cannabis. I was smoking cannabis 24 hours a day. I was stoned 24 hours a day to get rid of all the side effects. Cannabis allowed me to sleep, somewhat. It took away most of the shakes. It allowed me to calm down enough to get over the addiction. Now, okay? If you know anybody is addiction or facing addiction and trying to get off of it, tell them to reach for cannabis. The stronger, the frickin' better. Cannabis is non-addictive. And if you smoke it consistently, it can help you with other addictions. That's the reality. Okay? Understand that. THC is incredible. It's a good painkiller, not up there with Dilaudid, not up there with opioids, but it's a good painkiller. It's a damn good sleep agent, and it can help calm the effects of addiction. And if it wasn't for cannabis, I wouldn't have got off the Dilaudid. Okay? I need to go in for another surgery at some point. I don't know if it's going to be with this surgeon or I need to find another surgeon. The court's still out on that one. But at some point, I'm going to be facing the addiction yet again. And I'm not looking forward to it. Okay? Do I like the drug? Yes, I do. I can combine cannabis with Dilaudid right now. I'm taking Dilaudid pills. The most I'll take is 1 or 2 milligrams when I need it. Okay? I'm not taking it because I want to. I'm taking it because of pain. And I might take 2 milligrams before I go to bed because overnight, that's the worst. So I'll take a bit of Dilaudid and I'll take a bit of cannabis. And if you want a freaking good stone, combine those two. I do not want to face addiction again. And I need to fight the addiction. I need to fight the want to take more Dilaudid. And this is where willpower comes in. Okay? Once you're an addict to these drugs, you're always an addict to these drugs. Once you're an addict to alcohol, you're always an addict to alcohol. That's the reality. But I still have to face that addiction, and I don't have a choice, because at some point I'm going to be back in the hospital after major surgery taking 4 milligrams of Dilaudid 4 times a day again for the pain. I'm not looking forward to it. Don't judge drug addicts. There's a reason why they are a drug addict. There's a reason why these people are on the streets. As most times it's not their fault. Okay? Most times. Sometimes it is their own fault. Sometimes they're there by choice. But don't judge addictions. That's the reality. Have a good night.